Are you seeing things that others can't see?
University of Colorado researchers have built an app that uses artificial intelligence to measure thinking and speech patterns in patients with schizophrenia.
Tap along with the beat, then continue that same steady beat.
The app presents a 10-minute test that gathers hundreds of data points each time a patient takes it.
We can look at how you're saying it, what you're saying, what words you choose, how strong your emotions are when you say it.
A clinician seeing a human probably isn't looking to detect these very fine-grained, they're not sitting there counting how many words they spoke. It's the granularity that the computers are able to pick up on that is really impressive.
Chelsea Chandler, a researcher who analyzes the data from the app, thinks tools like this could help college students her age. According to the National Alliance on Mental Illness, 1 in 4 students has a diagnosable mental illness, and 40% don't seek help.
It's a big problem that the whole United States is dealing with, is a huge number of people dealing with mental illness, and getting coverage is not great. Going in to see doctors is not always the easiest thing.
The Proof of Concept app is part of a fast-growing field of new research that applies machine learning to mental health treatment. But supporting mental health with AI hasn't been regulated yet and begs several questions from critics. Peter Foltz recently published a paper calling for more policy and oversight of apps like his.
Clinicians have a lot of questions too, especially when it comes to the difference between a machine-learned app and the face-to-face interaction between a doctor and a patient.
The difficulty with folks with schizophrenia is that there's usually major disturbances. There's deficiencies in other life functions. So things like self-care, ability to maintain work, housing, those kinds of things are more difficult. Would a person who is unable to remember to brush their teeth every day or comb their hair or make themselves breakfast, are they necessarily going to be able to use an app?
Still, Dr. Joseph Soche thinks AI tools like this one could help with some of the intricacies that come with schizophrenia cases, like signaling that a medication is becoming less effective. He adds that schizophrenia is rare. The National Institutes of Health say less than 1% of Americans have the mental illness.